Okay. Welcome to the Health and Government Operations Committee. This is our February 25th voting session, and we're voting on voting list number 5. We'll start with bills which sponsor or whose sponsors have asked to have them be withdrawn. House Bill 235, 776, 902, 961, 1275, and 1351. I move that we allow the sponsors to withdraw their bills. Is there a second?
Second.
All those in favor say aye. All those opposed, no. Please raise your hand while I open the participant screen. Now I can see there are no hands up. Those bills will be withdrawn. And we'll move to House Bill 48. Aaron? Delegate Penny.
The bill establishes the Maryland Suicide Fatality Review Committee to identify and address the factors contributing to suicide deaths and facilitate system changes in the state to prevent suicide deaths. There were no amendments, and it was in the Public Health and Minority Health Disparities Subcommittee.
Delegate Penny Melnick.
Yes, thank you so much, Aaron, for your work in the subcommittee. So we discussed this bill, and it was actually a unanimous vote. And the fiscal no was reduced. I actually moved the bill, Chairman Pendergrass.
Second.
Is there any discussion of House Bill 48? Seeing no hands, all those in favor say aye. All those opposed, no. Please raise your hand in the panel. Seeing no hands, that bill passes unanimously. House Bill 49, Aaron.
This bill authorizes a nurse practitioner under the Emergency and Allergy Treatment Program to prescribe auto-injectable epinephrine in the name of a certificate holder and dispense auto-injectable epinephrine for its administration to a certificate holder. The bill establishes legal immunity for a nurse practitioner engaging in good faith in dispensing and prescribing auto-injectable epinephrine pursuant to the bill. There is an amendment on page 1 that was adopted in the Public Health and Minority Health Disparities Subcommittee that clarifies that the bill applies to registered nurse practitioners and clarifies that the immunity provisions extend to the prescribing of auto-injectable epinephrine.
Delegate Penny Melnick.
Thank you, Chairman and Aaron and committee. We actually discussed this bill, and it was a unanimous vote. I move the amendment.
Is there a second?
Second.
Is there any discussion? I see no hands raised. All those in favor? Do I hear someone?
Move the bill.
I think
Second.
we did that, but can't hurt to do it twice. All those in favor say aye. All those opposed, no. The ayes have it. Noes, raise your hand. I see none in the panel. It passes unanimously.
Thank you.
House Bill 109, Aaron.
I believe that was Delegate Lewis Young.
Shetty.
No, Delegate Lewis Young, did you want to?
Yes, thank you very much. I would like to recommend holding this bill. There are a couple of problems with it. You might recall I mentioned in the hearing that we should consult the State Advisory Council on Congenital and Hereditary Diseases. That is a council that was established by the General Assembly to weigh in on these matters. They have shared some concerns, and I think since we've empowered them with oversight, we should hear their concerns before moving this bill forward. Thank you.
Would the vice chair who chairs the subcommittee please respond?
Yes, so I have spoken to Delegate Lewis Young about this bill, and we also have a concern with the constitutionality issue, so we are going to hold it. Thank you so much for the courtesy. Thank you, Delegate Lewis Young.
Thank you.
My pleasure.
Okay, that bill is held. House Bill 260, Lindsay.
This bill transfers oversight of the inspection of the offices of physicians who prepare and dispense a prescription drug or device from the Office of Substances Administration to the State Board of Physicians. The bill also moves related provisions from the Maryland Pharmacy Act to the Maryland Medical Practice Act. The board must enter and inspect a physician's office within 6 months after issuing an initial dispensing permit and at least once during the duration of a renewed permit. The board must report any violation related to controlled dangerous substances found during the required inspections to OCSA. There are amendments that begin on page 2 of your packet, but the actual crux of the amendments appear on page 11. There are special sections that transfer positions, funding, and records related to inspecting the offices of physicians who hold dispensing permits from OCSA to the Board of Physicians. These were adopted in Health Occupation Subcommittee.
Okay, Delegate Kelly.
Thank you, Madam Chairman. The amendments and the bill passed unanimously. We did discuss this bill for multiple weeks. You'll see there's a letter in your file from the HGAU that was expressing concern, but the subcommittee really dug into that, and nobody on the subcommittee felt like the concern being expressed is something that would come to fruition. I think we looked again and again at all the places in existing law that gave us tremendous confidence that this was in no way going to minimize the ability of OCSA to do their work related to controlled substances. It was recommended by the HGAU as we took the vote that we look into whether this potential moving of the staff position might cause trouble for OCSA. So I suspect that is the ultimate concern that they had. But in the judgment of the subcommittee, this was the right thing to do. It streamlines the approach. It keeps us safe and makes things more efficient. So we adopted the amendment that makes clear about the funding for the staff position, which was the intent of the bill. And I move the amendment.
Second.
Is there any discussion on the amendment?
Move the bill.
Second.
Did I hear a second?
Yes, ma'am. Second.
Thank you. Any discussion on the bill as amended? All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. House Bill 373. Aaron.
This bill requires the Maryland Department of Health to ensure that the number of the state's postmortem examiners commission staff does not fall to a level that constitutes a phase 2 violation under the National Association of Medical Examiners. There's an amendment on page 13 of your packet that clarifies that the Maryland Department of Health is responsible for ensuring adequate levels of staffing for the Office of the Chief Medical Examiner.
Delegate Penny Melnick.
Thank you, Chairman. So we discussed this bill and the bill passed unanimous. I actually moved the amendment.
Second.
Is there discussion on the amendment? All those in favor say aye. All those opposed, no. The ayes have it. The amendment passes unanimously.
I moved the bill, Chairman.
Second.
Is there discussion on the bill as amended? All those in favor say aye. All those opposed, no. Delegate Krebs, you have a question? Unmute yourself so we hear you.
I raised my hand. Thank you. On the amendment, does that mean that the commission is no longer responsible? It's the Secretary of Health?
That's correct.
So the Secretary of Health. Okay. And
That's correct.
I just want to say that when you read the testimony, it's not that we're not paying people enough. It's that they don't have these folks out there. So I'm not sure how you meet a standard when they just don't exist. But you're putting a burden on somebody when there's already a problem. So you're paying these people $400,000 a year now, but at least it's not the commission because they really had no authority to meet the standard. So I guess that helps, but I still don't know how they're going to how to make this work. Doesn't solve the problem.
We actually have Maryland is the only state in the union that requested help from the federal government. As you know, there's a lot of chaos in that office, and we have to have some expectations and some rules and to hold them accountable. So I understand your point, and I respect it, but it's really, this is needed. But thank you. You're right, and that's why we put it on the Secretary of Health.
And listen, I will suggest a few years ago, Delegate Morheim arranged a trip for us in Judiciary to go down there to visit them. And Delegate Young was there. I was there. I don't know if any of you were there. It was one of the most meaningful site visits that I've ever had. that makes me really appreciate the job these guys do. So I would suggest if we ever have an opportunity, I don't know how many of us went, but I know it was an
did.
eye opener to me. And I would suggest doing it because it puts a whole nother light on the work that these folks do and the volume of work that they do.
Yeah, I took a tour myself and it was impactful, something that I will never forget.
Yep. Thank you.
My pleasure.
Okay, any further discussion?
Co-sponsor amendment.
There is an amendment. If you'd like a sponsor amendment, how about all those who do not want their name on this bill, raise your hand. I see Delegate Krebs' hand is up. I see no other hands. Correct me if I'm wrong, because we have multiple screens and I can easily make mistakes. Okay, we're going to amend this bill to add co-sponsors, and it will be everyone on the committee except Delegate Krebs. I assume we're all present today. If anybody's not here, please say we're not here. That was a joke. Okay.
Madam
Raise your
Chair,
hand.
Yeah,
I-
exactly. Raise your hand. Yeah. Somebody
didn't-
wanted to be recognized.
I didn't want to raise my hand and confuse everything. But while we were discussing sponsor amendments, I know I missed my opportunity, but I wanted to ask if it would be possible to do a sponsor amendment for HB 49 as a 20+ year camp counselor and director. I really appreciate this bill and I would love the opportunity to be on it if it's possible.
It's my memory that there is an amendment on that bill. Is that accurate?
Yes.
That is accurate.
Okay. Who would not like to be a sponsor on that bill? And if I see a lot of hands, I'll do it in the reverse. Is there anyone who does not want to be a sponsor on that bill? Okay, the whole committee is sponsoring that bill. And you understand my reasoning for not adding an amendment if there isn't one. It keeps things moving better. So that is my criteria. Thank you for bringing it up, Delegate Bagnall. I'm actually very proud of all the bills that are coming out of this committee. I'm happy with the work this year. Thank you all. House Bill 375. Lindsay.
As amended, this bill repeals exemptions from the Open Meetings Act requirements, meaning the Open Meetings Act will apply to these independent and regional development units. These are Maryland Economic Development Corporation, Maryland Agricultural and Resource-Based Industry Development Corporation, Maryland Clean Energy Center, and Bainbridge Development Corporation. The bill recodifies existing enhanced open meetings requirements that apply to specified public bodies and expands the application of the enhanced open meetings requirements to include the board of directors of the 4 entities I just mentioned and the Maryland Environmental Service, the Canal Place Preservation and Development Authority, the Maryland Food Center Authority, the Maryland Health and Higher Education Facilities Authority, the Maryland Industrial Development Financing Authority, and the Northeast Maryland Waste Disposal Authority, and establishes other specified requirements. There are amendments on page 14 of your packet that were adopted in Government Operations Subcommittee that establish that project site visits and educational field tours are not meetings subject to the Open Meetings Act for the entities covered in the bill, strikes provisions that would have included the Board of Trustees of the Maryland Automobile Insurance Fund in the bill, clarifies the documents that a public body must make available on its website, requires the agenda to the extent practicable to indicate the expected time the public body intends to adjourn to closed session, if applicable, repeals language relating to open meetings requirements of the Maryland Environmental Service. This language is being moved in the bill to the general provisions article, and establishes the intent of the General Assembly that the requirement to post certain materials may not be construed to limit discussions or deliberations to matters referenced in those materials.
Delegate Rosenberg.
Thank you, Madam Chair. As very well described by council, this bill extends the Public Meeting Act, the exemption on project site visits or educational field tours. The exclusion does not apply or applies if there is no organizational business being conducted, and materials dealing with the agenda and the minutes must be posted in a reasonable time specified in the bill as amended. It was unanimous. I would move the amendments, but there is a delegate who wishes to be heard.
let's second the amendments first, and then we'll hear from that delegate. Is there someone who would second?
Second.
Thank you. Delegate Carr.
Thank you, Madam Chair. Yeah, at the appropriate moment, I'd like to request to be added as a co-sponsor to this bill.
Okay. We will, after we vote on this amendment. All those in favor of the amendment before us, which is content, please say aye.
Aye.
Opposed, please raise your hands. Looks like it's unanimous. I see no hands. The amendment passed.
is amended.
Second.
I think we're going to have the second amendment first, if you don't mind, Delegate Shalega. Delegate Carr, would you like to make your motion, and then we'll go to you, well.
Yes, Madam Chair, I'd like to move a co-sponsor amendment.
I'll get to the vote. Is there anyone who does not want to be a sponsor of this bill?
Madam Chair,
Yes, Delegate Chisholm.
just a personal question. I'd just like to ask Delegate Carr how somebody else got to sponsor a Open Meetings Act bill, because I've never seen anybody but him do it.
You don't
That's a
have to
very
answer
good question.
that, huh?
How about we take that offline, since we don't usually ask questions of other people? But it is an interesting question. I agree with you, Delegate Chisholm.
Madam Chair, may I comment that the sponsor is from Montgomery County?
That the sponsor is what?
Is from Montgomery County. That may be a hint.
Okay. All those in favor, is your hand up, Delegate Shalega, to not be a co-sponsor?
No, I want to make a comment after we vote, please.
Okay, all those in favor of the sponsor amendment, raise your hand. All those opposed, no. The ayes have it. I see no hands. Delegate Shalega.
Thank you so much. So this bill came out of the STAR Commission, that I was a member of that commission with Delegate Corman. And but what I really wanted to point out was, you know, while COVID has been really terrible on almost every front, it has provided additional transparency for us and for other, you know, parts of government. And as we expand the open meetings law, you don't need to look there, but on handwritten page 24, this particular bill talks about a public body posting things prior to a meeting. Each open meeting agenda, together with a summary of any finalized documents, written testimony from the public, and other materials that the body will vote on at least 48 hours in advance of a meeting. It is my hope that the Maryland General Assembly will do that and actually post all those things online for the public, because as you know, we cannot see testimony from other committees until it gets to the floor, and the public can't see it at all until the session's over. So let's hope that, you know, we follow our own advice. And I know that's not you, Madam Chair. You don't have a magic wand to make that happen. But I hope that the General Assembly does to our body what they are doing to asking, rightly so, to other bodies. Thank you.
Thank you, Delegate Krebs.
No, I mean, Delegate Shalega makes a very good point. I don't know if this committee would be brave enough to amend this bill to include ourselves in it. I've had some constituents just in the last week complain to me about not having access to testimony. And I think it's really shameful that we push all this other stuff on these other bodies and we don't take the lead. And I really think that we should, and I mean this very seriously. And maybe this committee could think about that. I'll either talk to the speaker. I don't think they realize how inaccessible things are to the public. I mean, we can't even get committee testimony from other committees until after the bill hits the floor. And for those of us who like to read the testimony and decide how to vote on things, it's still very, very hard to do. And it's certainly not 48 hours ahead. So I would suggest, in all seriousness, that we do this for ourselves, because we should be the example. And all these little boards and commissions, it's difficult for them to do it. We have the ability to do it, and we just don't do it. We just don't release the information. We block people out on purpose. So I highly recommend that we do the same, and I'd be very proud of us if we would do that. So I'm not sure who to talk to, or we can amend it onto this bill if we're brave. So.
Thank you, Delegate Krebs. Delegate Shalega, your hand is up again. Are you asking to be recognized again?
Yes, sorry. In light of that, I would ask the chair to consider this, and we can maybe readdress it the next time we're together. But perhaps a letter from this committee that moves all of these open meetings bills forward as government operations to the speaker and to DLS or whomever needs to do that, that we, fulfill the same requirements we're asking of others, and especially with the testimony. And you can use this very language that's on, handwritten page 24 of your amendment packet. So please consider something that would move the ball down the field the right way. Thank you.
Thank you. Did we move and second the bill? I don't recall for sure that we did.
Oh, we did the amendments.
Yeah, but I think we need to move the bill.
I so move.
Is there a second?
Second.
Is there discussion, further discussion on the bill as amended? All those in favor say aye. All those opposed, no. Please raise your hand. I see no hands in the panel. The bill passes unanimously. House Bill 430. Aaron.
The bill requires an individual appointed as the Secretary of Aging to have extensive experience with and knowledge of laws, legislation, and regulations related to aging and of programs for aging individuals, including evidence-based and data-driven programs, and demonstrate a commitment to the missions of both the Federal Older Americans Act and the Maryland Department of Aging. There is an amendment on page 30 that strikes the requirement that the individual appointed as the Secretary of Aging have a bachelor's degree.
Delegate
Peña
Melnick. There you go.
Thank you. Thank you, Chairman. So we discussed this bill. We got rid of the bachelor's degree requirement, and the bill passed unanimous in the subcommittee. I move the amendments.
Second. Is there discussion on this bill? All those in favor say aye. All those opposed, no.
I move the bill.
Second.
Any discussion on the bill as amended? All those in favor say aye. All those opposed, no. Raise your hand, please. Looks like this bill passes unanimously. House Bill 536.
Question. Hands up.
Oh, I didn't see it. We need a darker hand to see, or I don't know what we need. Okay, thank you. Delegate Hill. Sorry, I missed it.
Okay. I would like to be put on as a co-sponsor.
There's an amendment.
Yes.
So that's reasonable. Are there other people interested in being sponsors of this bill? If so, how about give me a hand if you do not want to be a sponsor of this bill?
Madam Speaker, Chairman, is this House Bill 430?
This is House Bill 430, Human Services Secretary of Aging. Okay, I see Delegate Kipke, Delegate Shalega, Delegate Hill, Delegate Krebs, Delegate Riley, and Delegate Morgan, and Delegate Chisholm, who do not want to co-sponsor this.
Delegate Hill's hand was supposed to be down. I do want to be a sponsor.
Then Delegate Hill will be a co-sponsor as well. I'm sorry that I forgot to make that fine distinction.
Madam Chairman, I don't know if you listed me. I was one of the hands also.
I don't know either.
Me as well, Delegate Kaiser. I do not want to be a sponsor.
Okay, we got Saab and Kaiser, the last two. Does staff have this so that they know who to put on the bill? I know I did it in a backwards way.
I've got it.
Okay, good. All right, so we will do that. And yes, that is the easier way to do the sponsor amendment, is just who wants to be. So we'll just leave that alone. All those in favor of House Bill 430 as amended, please say aye. All those opposed, no. Please raise your hand in the panel. The bill passes, and the Ds are all co-sponsoring the bill. to clarify.
Not all the D.
Oh, right.
Us
All
Kaiser.
but Delegate Kaiser.
It's bipartisan.
Everyone but Delegate Kaiser. That's right. As with all our bills, it's bipartisan. I love that. Thank you.
Maybe
Okay.
Delegate Kaiser could join our caucus.
I'd like to see that.
So and I, we're very welcoming.
House Bill 536, Lisa.
This emergency bill gives the insurance commissioner the authority to adopt regulations that may be applied when a national or public health emergency that within the commissioner's discretion affects the state is issued by the President of the United States under the Federal National Emergencies Act or the U.S. Secretary of Health and Human Services under the Federal Public Health Services Act. There is also uncodified language in the bill that requires a carrier that issues Medicare supplement policies to offer a special enrollment period for certain individuals enrolled in Medicare Part B and Medicaid. And the uncodified language terminates 1 year after the termination of the national emergency or public health emergency, whichever is later. There are amendments on page 31 of your packet. The amendments clarify that the national or public health emergency must be based on a serious threat to health resulting from a deadly agent, and it makes a technical change to the termination provision.
Delegate Cullison.
Thank you, Madam Chair. This bill is just and the result of some learning that we've had over the last 2 years. The amendment was, and the bill itself were unanimous in the subcommittee. I move the amendments.
Is there a second?
Second.
Is there any discussion of the amendments? All those in favor say, oh, I see Delegate Shalega's hand. That hand is busy today.
Sorry.
It's all right.
I'm reading the testimony. There were some questions from the MIA. I'm assuming that's what your amendments have dealt with.
Exactly. The amendments were to clarify, because apparently there is a list of federally declared emergencies that really have nothing to do with health. And under the original language, all of those emergencies would have applied. We are very specific about which emergencies this would apply to.
And how limited did you make those powers for what amount of time? I mean, we do have some people on our side of the aisle that are concerned about overuse of emergency powers. So what can you tell me about that?
This would be for the period of time that the federal emergency exists, and then for 1 year out. So whenever there is a federal health emergency, then this would go on. There is no end date to this. There's no sunset to this.
But the emergency powers would go for an entire year after the emergency ended? I see Lisa shaking her head.
No, Lisa?
No. So the general emergency authority is actually just for the time of the emergency. There's the separate provision.
Oh, it's right. That's
the codified language that requires the open enrollment period in this one circumstance for when COVID's over. And that is for 1 year after the end of the state of emergency. But the general authority is just for the time of the federal emergency, if that makes sense.
Yes, it does. Thank you.
Thank you, Lisa.
Delegate Riley.
Thank you, Madam Chair. Just kind of as an example, so this last emergency that we had under COVID, was there a federal emergency? And if so, how long was that? And did we extend it here in Maryland? How would this bill affect that?
The federal emergency began in March of 2020. I believe it terminated in July of 2021. And the Maryland emergency, I think, extended slightly beyond that. I'm going to say until like October, but not the federal. And this bill applies to a federal emergency only.
Okay, so under this bill, it would have ended the exact same time frame that the federal requirement. Right. Okay, thank you for that definition.
I'm going to add something, if I may. The reasoning for this bill was that the insurance commissioner asked and worked with insurance companies to do many things to help our citizens get through the pandemic. And the insurance commissioner for a period of time had the ability to use the state's state of emergency. And that authority allowed them to do certain things. But when that was not enforced, not enforced, but inactive, when it was not active, the insurance commissioner can have a problem trying to make sure bad things don't happen to people with insurance policies related to the national state of emergency. So what this is doing is trying to protect policyholders and give the insurance administration the ability to do things that protect policyholders. Delegate Chisholm.
Thank you, Madam Chair. And to save me from reading through the whole bill, but it says they must come up with a plan. And if somebody on the committee could answer, who approves that plan at that point? Because I understand the intent of it, but when I was reading the first part of the bill, it just says the insurance commissioner must come up with a plan in the event that we're in a federal emergency again. So let's say they have this plan, who then, I guess, approves and then authorizes that plan?
My understanding it, let's go ahead, Madam Chair.
Delegate Cullison, was this discussed in your subcommittee?
No, this particular subject was not. My understanding is that the existence of the plan under the insurance commissioner, I'm certain that the governor would have at least knowledge of it. I'm not sure that the bill specifically says it's approved by the governor.
Okay, that concerns me a little because it's like telling somebody, when we see this all the time down here in government, you must have a plan, but if we don't know if somebody went over and looked at that plan and said, this is a good plan, if in the event this happens again, we could be caught once again, unable to respond quickly because nobody ever really looked at the plan. And it's not that I think they would be acting in bad faith, but I'd love to know who's going to look at the plan, but I appreciate the answer.
Just so it is going to be in regulations though, so that we'll go through the whole AELR process and all of that.
So AELR would then approve the plan. Am I correct on that?
AELR doesn't exactly approve, but if they had an issue with it, they could, bring it up.
I just would like another set of eyes on a plan that is vital.
The commissioner is accountable to the governor. There is that level of authority. So
right, I understand. Thank you.
Thank you. It was an interesting question. Is there any further discussion? And I will admit that I don't recall if we've moved the amendments at this point. Did we move the amendments?
We've moved the amendments. We haven't voted on them yet.
Yes, I knew that. Okay. Is there any further discussion? All those in favor of the amendments, please say aye. All those opposed, please raise your hand in the panel. Seeing no hands, the bill passes, or the amendments pass unanimously.
Move the bill as amended.
Second. Is there any discussion on the bill as amended? Seeing no hands, all those in favor say aye. All those opposed, no. Raise your hand in the panel. Seeing none, the bill passes unanimously. House Bill 970, Lisa.
This bill prohibits a carrier or Medicaid managed care organization from applying a prior authorization requirement for a prescription drug used as post-exposure prophylactics for the prevention of HIV. The bill takes effect January 1st, 2023, and applies to all policies, contracts, and health benefit plans issued, delivered, or renewed in this state on or after that date. There are amendments on page 35 of your packet. The amendments remove the requirement that the prescription drug be prescribed to a victim of an alleged rape or sexual abuse, and instead provides that the provisions of the bill apply if the prescription drug is prescribed in accordance with Centers for Disease Control and Prevention guidelines.
And
Delegate Gleason?
right, thank you, Madam Chair. This bill was discussed in committee, and the amendments clarify that the prohibition on prior authorization is as long as these particular drugs are being administered under the guidelines of the CDC. So the discussion and the amendments and the bill were voted on in support unanimously. So I move the amendments.
Is there a second?
Second.
Is there any discussion on the amendments? Delegate Kelly?
I think my discussion, we could have adopted the amendments, but I just wanted to make sure that committee staff knows this cross file for this bill was held in finance last night because there is a larger bill that also includes this that was heard in EHE. And I believe that finance was secondary on it. So they passed that version of it. We did not get a House cross file of that version. So that's the status. So we could potentially be passing something that will not be necessary should we pass that larger version of the bill that Senator Lamb has potentially coming over from the Senate. I just wanted to make sure the committee was aware of that.
Okay,
Thank you.
Thank you for that. And I'm sure that if they think we don't need it, they won't pass it. And then we'll have a discussion about that, I suppose, but we'll put that off. Is there any discussion on the amendments? Seeing none, all those in favor say aye. All those opposed, no. Please raise your hand. Seeing no hands, the amendments pass.
Motion to co-sponsor.
Oh, well,
You
let's
know
move
what?
the bill. Move the bill as
Hang on,
amended.
yeah, I decided that that was too complicated. We'll just leave the co-sponsor thing to the end. Is that okay?
Yeah.
Delegate
Yeah,
Morgan?
and I thought that's what we did. I thought we just
We
passed it.
did, and I tried it, and that was really unwieldy. So we'll go
Oh.
back to the old ad hoc way of doing it, if you don't mind.
Okay.
Okay, I figured it out. Sometimes you have to do it wrong to figure things out, and I did. Okay, so
Can we still co-sponsor it?
we'll be able to, yes, I promise. All those, was there a second?
Second.
Okay, all those in favor, say aye. All those opposed, no. Please raise your hand. Seeing no hands, the bill passes unanimously. Is there anyone who does not want to co-sponsor this bill? I'm looking for hands and I'm seeing no hands. Okay, the committee will be sponsoring this bill. House Bill, let's just stop here for a second. House Bill 937, 952, and 1171 are three bills that we had hearings on that have to do with choice. And I believe you all got a text from me saying that they would be on the voting list. And I've been very clear that these bills, I intend to hold them. I want to make sure everybody has the time that they need to look at them. Have your amendments ready for a week from today. And let me give you a heads up here. If you have not had the courage to look at your calendars yet for next Friday, we do have our first Friday bill hearing. So we will not be getting to the voting session that night until that night. It will not be at 1 o'clock as this is today. It will be after our bill hearings. I'm not sure what time that will be, but we will be as efficient as we can be. But that's when our voting sessions will have to be. And we do have a lot of Friday and Monday hearings now scheduled. So please just take a look at the calendar so that you're not taken by surprise, as frankly I was when I realized that we were going to have a voting session on Friday night. We do want to get bills out on Fridays so that they get to the floor on Tuesdays and they get voted third reader on Thursdays. So we're going to stick to that for now. And we will entertain all amendments on these bills a week from today, whatever time that hearing turns out to be. I think we'll try to post it as being immediately followed, or maybe it'll be some number of minutes following the bill hearing, so everybody can kind of take a little break, about a half hour maybe. Are you guys good with that? Does a half hour sound good to everybody? Does anybody have any strong preference for something else? Okay, we'll schedule this for a half hour after the bill hearings end on Friday. With that, I think we've done the work in front of us. Staff, have I missed anything? Okay, we've completed the work in front of us for today. I thank you for working hard always, Delegate Kelly.
Madam Chair, I think that Erin was going to just walk us through the sponsor amendments so that the committee is able to work from the amended bill.
I'm
as they
sorry.
consider it.
I'm sorry. I think that would be a good idea. Thank you for reminding me of that. I hope everybody's comfortable with that. I hope you don't feel that I'm pushing it or moving it too quickly. Wait till next week. I'll push it then. But this week, I want you to have all the information you need. Erin, would you walk us through the bill?
So there's House Bill 937 is on pages 36 through 43. And this establishes the abortion care clinical training program in MDH in the abortion care clinical training program fund to support the program. For each fiscal year, the governor must include in the annual budget bill an appropriation of $3.5 million for the program. And the bill also defines a qualified provider. The amendments would add co-sponsors. They also provide that the training requirements in the clinical training program include a focus on the provision of culturally congruent care and include implicit bias training. And they also strike the language in the bill related to parental notice requirements, thereby retaining the current law as it relates to parental notification. So that's House Bill 937, which is handwritten 36 through 40 of your packet.
32.
Is that an interlineated
Yes.
version?
So there was a second email sent that had the interlineated versions of the bills.
Okay.
So that's House Bill 937. House Bill 952 starts on handwritten page 44 of your packet. And this bill establishes requirements regarding how an insurer, nonprofit health service plan, and health maintenance organization, as well as Medicaid, must cover abortion care services. By January 1st, 2023, the Maryland Health Benefit Exchange must adopt regulations to provide a subsidy to cover 100% of the cost of premiums for individuals in the state-based young adult health insurance subsidies pilot program for calendar 2023. MHBE must convene a work group on consumer information about abortion care coverage and conduct a study on extending last dollar coverage and submit certain reports. The amendments add co-sponsors. They clarify that an organization that is eligible for an exclusion under the section of the insurance article related to coverage of contraceptive drugs and devices may also obtain an exclusion from the coverage and notice requirements of the bill if the requirements of the organization's bona fide religious beliefs and practices. They clarify that the subsidy requirements related to the young adult health insurance subsidies program apply to the young adults have a 0% expected contribution to the subsidy eligibility parameters that are established in calendar year 2023.
Would I be able to attend that?
And then the speaker's bill did not have amendments.
Okay. Okay, so if you need clarification on what the amendments do, Delegate Kelly or Erin Hopwood would be the people to ask for that help. It would be very useful if you would get any amendments to the committee. I would say the day before, but since Delegate Shalega likes 48 hours before and Delegate Krebs does, 48 hours would be even better if you can do that. I'm going to start with Delegate Rosenberg, who has a hand up, and then Delegate Krebs.
Thank you, Madam Chair. There was a second mailing to the committee that also includes the bills, but yet, Aaron, you were referring to the numbers, page numbers you gave just now were in the earlier mailing to us. So
they weren't on that second mailing?
Yeah. No, is it the second mailing? Are those the bills as amended that will be before us?
Correct.
Next week?
Yes,
Okay,
those have the handwritten pages. That
from
were
the second version,
correct.
the second email, most recent. Thank you.
Yes, yes.
Thank you. Okay.
So look for handwritten pages. Delegate Krebs.
Yes, Madam Chair, and you mentioned about best practice of this committee, and we normally do have a very well-run committee, but I will tell you that last week I was really astonished and embarrassed of the way we handled these three bills. And I've had so many complaints from my constituents of total confusion. They signed up to talk. You said talk about all three bills at once. And they're very, very serious issues to my party and to my people. And each of them deserved a full ability to be able to testify on them, and combining them all together and telling people they had, 2 minutes to talk about three bills, I think did a disservice to those of us that take this very, very seriously. So I would suggest in the future, unless bills are very, very similar, I mean, just because they're all about abortion does not mean that they're all similar. They're three distinctly different bills. And I think it was very unfair to the people that waited and put their testimony in that they really couldn't, they had to do everything at once. So I would just suggest in the future that we try to treat all bills with the courtesy which they deserve, and let people weigh in on them and have a question. I mean, I didn't even know what bill we were talking about. I was like, I didn't even know what they were. So I was confused as a committee member. So I would just ask for, if we got rules and we do things a certain way, to please do it consistently for all subject matters, not just ones that are uncomfortable. And this is uncomfortable for everybody, but I was really embarrassed and have taken a lot of heat about not speaking up about it. And I personally didn't even know, I missed the very beginning of the bill hearing, and I didn't even realize what we were doing, that we had combined the bills. So just food for thought. It's over with, but I don't have an excuse for my people, so I'm stating my displeasure currently. So thank you. We've not done this in the past that I know of, but thank you.
Thank you, Delegate Krebs. We do this consistently in the past with these bills and with other bills. And in the same hearing day, we did them with the cyber bills. And people were allotted 4 minutes to testify on more than one bill, not 2 minutes. 2 minutes if you were only testifying on one bill, just to correct the record. But I appreciate your feeling comfortable enough to share your concern with me and the committee. Thank you.
And the people I don't think they knew it coming. They knew it right when there's people spend a lot of time preparing, and they're not great at this. So when they prepare to talk about three different bills at three different times, and then at the last minute, I got to now figure out what I'm going to talk about. It's just confusing for people, but just take it for what it's worth. Thank you.
And the rules were on the website, Delegate Krebs. We carefully posted them so people would understand them when they signed up. But again, thank you. We can always try to do our best, and it's always helpful to hear from members. So with that, have a wonderful weekend. And I will see you again bright and shiny and happily, not for a hearing on Monday, but we will be back to hearings again on Tuesday. And I know that the Public Health Subcommittee meets on Monday. So you'll be doing your work, and we are grateful to all of the members and all of the subcommittee chairs for getting the work through and doing the really hard work of this committee. So with that, Delegate Sample Hughes, did you have something to add?
Yes, thank you, Madam Chair. I did hear the comments of our members just a few moments ago regarding the testimony and the bills. So I want to let you know you're being heard, and I will share that with the speaker accordingly at our leadership meeting, okay? You did mention that last year, and we did make some modifications, so there was change, but we certainly hear you, and I just wanted to acknowledge it. Thank you.
Okay, with that, everybody have a great weekend. Bye-bye.
Thank you.